So moving on to another issue that's been of great concern in Western Massachusetts, the opioid addiction crisis claimed over 1,500 lives last year. Eric, you've talked about your work in passing a bill to reduce the price of Narcan and to control opioid prescriptions. Chip, you've spoken about this, that you've had experience as a part-time police officer dealing with this on the streets. So I'd like to hear specifically about what we can do more, what we can do in the future, not rehashing what we've done over the last term, but what specifically the state can do to address this problem in the next 2 years. Senator Lester, you can go first.
Yeah, very, very important question. And unfortunately, we have quite a lot more that we need to do around substance abuse. So one very important thing is more than 3/4, over 75% of the heroin deaths that we saw last year began with legally obtained prescription drugs. We worked collaboratively with the Baker administration last year on a substance abuse bill that focused predominantly on prevention. What we need to do is we need to go even further, and we need to bring the medical community into the discussion. So we need to beef up training at our medical schools. We need to include prescribers and pharmacists, physician's assistants. I spoke to a group of physician's assistants at BayPath recently. They're really on the front lines of this. We need to train our medical providers, and we need to change the culture around prescribing of some of these very dangerous narcotics. And there's another issue here that's very important and that's worth discussion, and that is the role that insurance companies and the sort of structural economic system is playing in pushing this epidemic. And here's what I mean. Right now, if somebody goes to a doctor, they go to a hospital, or they go to a medical provider and they have pain, and that doctor or that provider gives them a Percocet or a Vicodin or prescribes a highly addictive narcotic, which may be completely appropriate and completely in line with the science and what the data suggests. That treatment is reimbursed at more than a 90%, even 95% rate by the insurance company. What isn't reimbursed at the same rate are non-narcotics-based pain management techniques, things like acupuncture, physical therapy, other types of remedies that aren't addictive. So what we need to do is we need to begin to reorient our prescribing culture and our insurance system to provide more opportunities for people to get treatment for their pain through avenues that are not highly addictive and that don't have the potential for this type of abuse. So those are the types of things we need to work on in the coming months, and that's what we're going to continue to be focused on. One last thing, I realize we're going on, but I'll make sure Chip can make up on the time. But another item is we need to increase collaboration of our law enforcement communities. Right now, you have a constellation of law enforcement agencies working on substance abuse prevention. You have the DEA, you have our district attorney's office, you have our sheriff's office, you have the local police departments in each city and town, you have the state police, you have the FBI, you have a broad constellation of agencies and groups all working on this. What we need to do is we need to put some investment in and some thought into how we sync up efforts, how we coordinate efforts, how we better share information, so that we're not being duplicative and that we're being as effective as possible.
Right. Thank you, Chip.
So this issue I've talked about from a very personal level, even when a couple years ago when I was involved in the same race, because as a part-time police officer, as you mentioned, Dan, I have stood in the kitchen consoling a mother while her son is being worked on by paramedics in the basement. So everybody who's watching and everybody in this room right now, we all know somebody who has struggled, maybe possibly still struggling. It's really reached into every community. It doesn't matter if you live in Belchertown or Longmeadow or Springfield or Chicopee. It's everywhere. And it's really multi-leveled, I guess I can say. So from the federal government level, we do need to do something about our borders, whether it's building a wall or something like that. But these drugs are literally pouring into this country. And they're ending up right here in the New England area. We have some of the cheapest heroin than any other place in the entire country. That needs to be taken into consideration. And our local delegation, the local legislative delegation, needs to put some pressure on our congressional delegation to do something about what's taking place and the drugs that are coming in here. When you notice that we've been involved in this war in Afghanistan for many, many years, but yet the poppy production in Afghanistan is higher now than it's ever been. There's something that is to be said about that, because the poppy seeds are what makes the heroin. The other component that we can really do on a legislative level is streamline the process so that private vendors who do addiction care services for people can get into the market. Right now, there are agencies out there that are trying to become addiction counselors that are going to be able to take Medicaid, Medicare patients, but they can't until they get certified by the state. And that document is a 196-page document that they need to adhere to. It's much too cumbersome. It's much too much bureaucracy that takes place. And we see this all the time when government gets involved. They make it more difficult for people to get into the service. So as your state senator, I'm going to lead the charge to streamline that process so that private vendors can get into addiction counseling. And it's not just for the Griswold Center or AdCare or some of those other agencies that are in the area, but private agencies can get into it, because we really do need a lot more outpatient services that are available for people. Another thing I want to mention too, and this hasn't even been really brought up in the newspapers yet, but there's a new drug that's coming up here. It's called carfentanil, and it is 100 times more potent than fentanyl. Heroin, which is a obviously highly addictive drug, these are synthetic versions of those. And carfentanil, Narcan can't bring you back from carfentanil. You need multiple doses of Narcan to do that. I'm very concerned that when that hits the New England area, the death rate is going to skyrocket once again. If you thought it was bad, it's going to get worse. And that's being discussed within the law enforcement community right now. And our local legislators need to be aware of it, because we need to be prepared for it. The amount of beds that are existing out there are just not enough for people who are truly trying to get themselves clean and healthy. And we need to support those families that are working on it. Like I said, we all know somebody who's struggling with it. There's too much available to them, and quite frankly, the prescription drug companies need to be held accountable as well too. Narcan, I've seen it used. I've watched our paramedics use it. It's a great drug, but that is another drug that the pharmaceutical companies are also profiting from. We need to hold them accountable for the amount of drugs that are on the street, and the Massachusetts legislature needs to take the lead on that.